Today, the Indian narrative, it mainly focuses on from where this tissue is made and how it is processed, what are the new strategies utilized to prevent early degeneration of this bioprosthetic valve, to prevent early calcification of this bioprosthetic valve. And overall, how many patients have been implemented across India and also abroad. I'll be going to this in the next few minutes. It was developed by the India's well-known industry, that's Merrill, and the pericardium is harvested from reputed abattoirs, that is the slaughterhouses in Australia and New Zealand, to create a fully functional bioprosthetic valve, that is the heart valve, which has been made in India. Well, mainly it undergoes deep anti-calcification process, reduction of the bioburden part, advanced methods to handle the bioprosthetic tissue valve, and establishing predictive preclinical in vitro and in vivo models to establish biofunctionality of the heart valves, which can postulate long-term durability. Till date, it's almost crossed 7 years. In fact, the transcatheter valve came into picture first. Subsequently, after that, after 2 years, we started using the surgical valves. I'll come to that in detail in the next few slides. And also to establish the long-term durability via human clinical trials, and thus longevity of the artificial bioprosthetic valve to be noted. The clinical trial is almost completed. It's already into the market. As I mentioned, it is a valve which is got from the cows, and they are derived from processed biological tissues to be implemented into the humans. The development of such devices originated in an attempt to circumvent some of the clinical complications associated with early development of mechanical heart valve, and also has resulted in a rapid proliferation of bioprosthetic valves for a variety of applications. We can use either valves, vascular grafts, biohybrid vascular grafts, ligament substitutes, pericardial patches, and many more can be utilized from these bioprocesses. As I mentioned, it is sourced from Australia and has undergone a lot of required scrutiny before implementing into the human systems. They are all well certified. This is the standard international certification before you use a bioprosthetic valve. And one has to be familiar that where it is procured in Australia, starting from the birth of the like a calf is born, and as it grows till the time of slaughter, it has been monitored very closely. All vaccinations been done. Any disease process has to be looked into very clearly, and it is very specific that I think most of them are familiar with this mad cow disease, that is bovine spongiform encephalopathy, which is free from these pericardium which is procured at these places. Well, these are the different techniques of how the valve is fixed. But I would like to just put that the most widely used polyfunctional molecule is the 5-carbon molecule of glutaldehyde. And this technique in turn inhibits, I'll come to that next, it inhibits early calcification in these valves. Well, development of anti-calcification process is a new entity which has been brought into picture in these bioprosthetic valves. That is, ethanol pretreatment of glutathione cross-linked tissue significantly alters the material, rendering it unfavorable for lipid absorption. And lipid abstraction by combination of ethanol and surfactant would mitigate calcification of glutathione-treated bioprocesses. As I mentioned, glutathione cross-linked tissues with mainly a denaturant, a surfactant, and a cross-linking agent, which in turn will reduce in vivo calcification. It's a process which has been conducted in their main branch at Vapi in Gujarat. The leaflets are washed with 0.625% of glutathione to make it free from the treatment solution. Then they are fixed on the bioprocesses frame and undergoes various tests. And after that, each valve undergoes a revolution, which is finally fit to be implanted into the human system. The durability testing and the dynamic failure are checked according to the Indian standards guidelines of 8403-3. This is coding of that guideline. And they undergo the testing in these machineries. An animal implementation was done in sheep to study the challenges faced, and which turned out to be quite fine in the follow-up of even about 3 to 4 years in the animal models also. Coming to the current valve, which is come to picture, it has been modified almost, designed and redesigned almost 3 times. And now they have come up with a daffodil neo valve. I was one of the part of the investigators of this valve when the clinical trial was ongoing process 5 years back. It's a tri-leaflet valve, and the frame is composed of acetyl copolymer, and the commissures are with the PET film structures, and the frame is made of alloy in a wire form. And we have a polyester fabric, a sewing ring, and suture markers on that valve. The neo valve, which has been just introduced last year itself, has improved profile. It has reduced dimensions, especially the mitral protrusion. If you see the previous valve which has come up, which even I had implanted, I used to observe a gradient across the LVOT after replacing the mitral valve. In fact, all the cases I had preserved the chordae. A gradient of at least 8-10 was coming. And that time we gave feedback to the manufacturers, and over a period of time they have modified it. And in the present neo valve, even that point has been addressed. I have follow-up of all those patients, and the gradient remains same, doesn't increase, and there are no as such symptoms. But on echocardiography, we do get that gradient across the LVOT. Of course, improves the stent to tissue annulus diameter ratio. And the new one which they have introduced in IoT position is even 17 size valve has been come into the market, and it has been available only on request. As I mentioned, it's the 3 tri-leaflet valve. And before we implement it, it undergoes testing. In each valve undergoes a testing of almost around 200 million cycles proven in vitro durability. After that only it is packed and sealed off into the market. And as I told, how it can be an anti-calcification property, what exactly they do, they treat it in the nitrogen gas atmosphere, which eliminates air oxidation of aldehyde to acids, and which in turn prevents attraction of calcium ions. A denaturing agent is used. In fact, they don't declare what is the agent they are using. That in turn reduces the bioburden and phospholipids load from the residual biological debris. And a surface active agent removes phospholipids from deep intracellular compounds. All these things help in preventing calcification at the earliest. I think people who are used will be familiar with this valve. These are different components of the valve, whether it's a polymer support ring or in an alloy form, the frame which is formed, the tri-leaflet valve, sewing rings. And of course, we have both the aortic and the mitral processes of various sizes. These are the holders with ease of expanded. Once we implant and cut down those sutures, it can be easily, the holder can be easily expanded. Should not be a problem. This slide depicts the same, that is the type of materials used and the sewing ring, about the sewing ring and the ease of implantability. This is how it comes in a packed stage, wherein we do take a sterile holder and try to hold it with this holder, and has been expanded from the container which is available. Normally, after expanding, we normally wash I normally use it in the 3 separate bowls of saline up there, wherein we wash it with saline. And even though the cultures are negative and it is in sterile format, we as a protocol always follow to send 3 cultures of all the 3 saline bowl washers. I wash it for a minute on each bowl, and each minute, and that is sent for culture, and subsequently a follow-up is done on the culture report. Till now, we have not grown any culture, any issues of that kind. Well, last 5 years, as I mentioned, the surgical exposure with the 5 years follow-up what we have. So we do have replaced with the 19 mm sizes valve with a gradient of around 12 to plus 5, and even a 21 size valve with a gradient of around 9 to 6. These are the various specifications of the valve which will be depicted on the valve per se itself. Whenever we use, all this information data will be available with us. Valve sizes vary between 17 to 29, both in aortic and in aortic, and in mitral from 23 to 33. 23 and 25. I have not used 23, I used 25. 23 and 17 valve sizes I have not used. Well, the average age group, what we had done, the clinical trial and subsequent last 5 years, the average age group of mitral valve was around 49 plus or minus 14 years. And the aortic was 60 years plus or minus 20, plus or minus 8 years. The clinical trial was conducted in 19 centers and 136 patients were followed up. And in fact, I ended up doing the maximum valves in the country, around 46 valves during the clinical trial itself, that is during a 1 year period. Subsequently, a DCJ approval was called for, wherein the DCJ, they had raised some issues, and after that, even that was clarified and DCJ approval has been given. It is not FDA approved valve. Of course, even our TTK Chitra is not FDA approved. We have implanted almost in the country and abroad around more than 1.9 lakhs of TTK Chitra till date today. So for the current Indian population, if you ask me, yes, definitely it makes a huge difference. And we have been using this valve and many other centers have been using it. And today it's already in the market. Other than USA, UK, Germany, Japan, I think the rest all countries have started using daffodil valve. It's been published in the European Journal about 4 years back. And we have 6 years follow-up of these cases. And overall trial size performed in this follow-up of the cases, the mean pressure gradient as well as the effective RFS improved significantly. And in the last almost the full follow-up, what we have of completed follow-up of 3 years. Most of the aortic valves, what we implement or across the country, what people see, especially in India, is of annulus of around 19 to 21. That's the common valve. I ended up using 25 valve also. I ended up doing root enlargement procedures have been done. 2 cases I have done root enlargement procedures. A follow-up of one is of 4 years, another is just around 18 months follow-up is there. They're doing well in age group of around 60s and 70s. Even aortic ascending aorta replacement has been done using this Bio-Prosthetic valve. And all mitral valves, as I mentioned, always end up preserving the chordae almost completely, or try to debulk as much as possible, and always go ahead with the preservation of chordae. Double valve replacement in our institute I have not done, but there are institutes who have done 1 or 2 double valve replacements using the same valve. Thank you.